Definition. Spina bifida is a condition that affects the spine and is usually evident avert. It is a type of neural tube defect, NTD. Spina bifida can appear anywhere along the spine if the neural tube does not close completely. The spinal column that protects the spinal cord does not from and does not close in a should. This usually causes damage to the spinal cord and nerves. Spina bifida can use physical and intellectual disability ranging from mild severe. The severity depends on the following: the size and localization of the opening in the spine, if part of spinal and column nerve affects.
The first stages of the developmental defect of spina bifida occur in the first 2 to 3 weeks after conception, before the mother knows she is pregnant. The defect can occur anywhere along the length of the spine, but most commonly occurs in the lower back. The severity of the defect varies greatly from one individual to another, ranging from no noticeable impact to severe paralysis and loss of sensation. Lesions higher in the spinal column result in more weakness of the trunk and possibly the arms, as well as the legs. Because the nerves that control the bowel and bladder are located on the lowest part of the spine, the function of those organs will likely be compromised in all clinically significant cases. Myelomeningocele, the most common type of spina bifida, presents as a sac of exposed meninges or spinal cord membranous coverings, frequently containing parts of the spinal cord and the nerves attached to it. When a baby is born with this condition, it is critical to surgically repair the defect and cover the lesion with skin within the first 24 to 72 hours after birth to prevent infection in the nervous system and further nerve damage. 80% of children born with myelomeningocele will also have hydrocephalus. Hydrocephalus occurs when the cerebrospinal fluid flow is obstructed or blocked, and then pressure from that fluid may build in the ventricular system, causing the brain and skull to expand. It is typically treated by surgical insertion of a shunt to allow the fluid to flow out from the brain. It is important to note that each child born with spina bifida is unique and will have different degrees of clinical symptoms and functional limitations. With the appropriate medical care, rehabilitation, guidance, and encouragement, many individuals with spina bifida may live productive and fulfilling lives.
Application of physical therapy. Therapists and parents should consider how to the movement, context influence the legs movement and kinds of infants with spina bifida. Development of physical capacitations that make independence possible. Independent and movement, walking in a wheelchair. Finally, prevention of the second deformation. The child may be in the hospital for a month or two. Posture care in the incubator according to joints deformation. If it was high-bus, we will change the position of the head, the avoid asymmetric neck contractors. Preparations of splines and handling them to avoid friction with the skin. No more than 2 or 3 hours in a round and combination with mobilizations. Encourage the child's contact with her parents. Excellent sensory simulation once the child's at home. Encourage head control, simulation in the palm positions with support of the forwards and opening of the hands. Facilitation turning, it is important for the child to develop the internal representations of her body's chain. To do this, facilitate the grip of your legs and feet. For work in front of a mirror. Then in physical therapy, lower limb mobilization, avoid retractions, simulation control with stick, lower limb mobilization to maintain maximum weight. If the deformation in the face is reduced, surgery will be necessary to facilitate standing. Adaptation to others to start ambulation, relocation of gazing parallel and in front of the mirror. Use the weight chair.
Spina bifida is a fairly common birth defect that occurs in 1 to 2 out of every 1,000 live births. What normally should occur early in fetal development, or the development of your baby, is the neural tube starts off as a flat plate of cells. And then around 6 weeks into development, that flat plate zips itself closes and forms the neural tube. Inside that tube, the nerves from our brain run down to our limbs, so to our arms and to our legs. And the neural tube forms a protective barrier so that those delicate nerves don't get damaged. In cases of spina bifida, also known as a neural tube defect, what happens is that zipping process doesn't go quite right. And there can be a gap in the neural tube that allows those delicate nerves to come out of the body, usually out of the skin, and they're damaged as in exposure to the amniotic fluid. When there is damage to those nerves, when the babies are born, we do surgery to repair the opening, but the nerves have usually already suffered some damage. As a result, people or babies with spina bifida or children with spina bifida usually have some degree of paralysis or the inability to use their legs to some extent. So some people with spina bifida will undergo surgery and have a limp or need some sort of help with bracing. Other people with spina bifida will use a wheelchair. So there's some degree, but usually no matter when we are able to do surgery, there's some damage to those nerves. Spina bifida can happen in any pregnancy to any woman. We know there are some risk factors that can make a pregnancy at higher risk to have a baby with spina bifida, and those include moms who are diabetic, when there's been a family history of other individuals with a neural tube defect, or some women on certain medications. But most of the time, spina bifida happens in a pregnancy where we didn't know there was a higher risk. And that's why we talk so much about folic acid. Folic acid is a B vitamin that we know helps reduce the incidence of spina bifida. Usually people get folic acid in their diet, but we recommend that any woman of any childbearing age take a vitamin that has 0.4 milligrams of folic acid. Because that neural tube closes so early in pregnancy, sometimes a neural tube defect has formed before a woman even knows she's pregnant. For women that we identify that are at higher risk to have a baby with spina bifida, we'll typically recommend more folic acid. So it's a good idea to talk to your OB if you're considering having a baby and think you have any risk factors that would increase the risk for this birth defect.
Pros and cons. Pros. Affected babies in Ecuador improve with physiotherapy, surgery are good options, life hope is high. Cons. Has no cure, may be hereditary, put the life of the baby at risk. The child needs technical help all his life. Issue applied in Ecuador. Spina bifida is a serious disease that occurs due to a congenital malformation in a pregnancy between the second and third week gestation. It is a nature tube defect. In Ecuador, between 8 and 10 out million newborns present some neural tube malformation, according to Spanish collaboration study of congenital malformation. The neural tube is a canal that closes the oval of the formation of the cervical nervous system of the future baby. When it is thus not closed properly, the bone marrow completely unprotected. This situation caused serious damage to the baby and the birth, citing affect to the central nervous systems. The locomotor system is the genitourinary system. The exact causes of the disease are unknown. Experts point is a decision combination of genetic and environmental factors. There are some risk factors if the mother is diabetic, consumes alcohol or drugs. In certification queries has a poor diet, following treatment with sex hormones. Conclusion. To conclude, this is a deformation that are not very frequent, but that usually interferes with the psychomotor development of the child who suffers from in a significant way. Physical therapy plays an important role in the children in a childhood quality of life. Babies with spina bifida who had their spinal injury repairing the wound move their legs and kick quite often. They seem to be sensitive to the context of the moment they are in. Thank you.